Seasonal affective disorder is a type of depression. So it's not a separate disorder, but it's considered a type of either what we think of as major depression, or sometimes people think of that as regular depression, or it could also be a subtype of bipolar depression. And it's relatively common. I think we hear about it a lot in the Pacific Northwest, thanks to our weather, and winters can be tougher here. The current theory is that changes in the circadian rhythm and changes in our light exposure during the winter can affect our neurotransmitters and affect the way that we feel and are able to cope with our day-to-day life. I see quite a few patients in my practice with depression and anxiety, and this year we've definitely seen more folks, and absolutely this has been a more stressful year. It's something that mental health professionals are really experienced and capable in helping people with, but it's also something that we see really commonly in primary care. So your primary care provider has a lot of experience seeing folks with seasonal affective disorder and with depression and anxiety. One option is light therapy for folks, and it's a very specific type of light therapy. So not just a bright lamp that you have at home or a bright overhead light, but it's a specific lamp approved for seasonal affective disorder that's 10,000 lux or higher. And usually we're doing at least 30 minutes a day, preferably in the morning, has been proven to be more effective. I recommend talking to your primary care provider or your mental health professional about finding an approved light box, and they can give you a list of boxes that are good. We have lots of antidepressants that are available, and they each have slightly different properties, and all primary care providers are capable and experienced in helping people choose the right medication for them. One thing we know about depression is that it tends to feed on itself. Once people are feeling down and they're feeling depressed, they often withdraw from their normal activities, and they're not doing the types of things that used to bring them a lot of enjoyment. And that just makes the depression worse. So there's a type of therapy called behavioral activation, where we try and engage people in their normal activities. And the trick is to do activities not because you necessarily feel like it, but because you know that it's good for you.